my pain management doctor, Kristen Bites, is the one who referred me to Dr. Smith. And she believed that the two of us would click, and we did. It was kind of a, I don't know, just a rapport from the beginning. It very forthright, honest. I felt very comfortable asking him questions. He was very direct with the information, those kind of things, which made me feel comfortable. The work that I do, I don't like people who, you know, skip around or minimize, candy coat things, exactly, and that's not Dr. Smith. If it wasn't the confidence in Dr. Smith, I think there would be a little more apprehension on my part, but just the fact that my primary doctor recommended him, it speaks volumes, because I have a lot of trust in her, and that made me comfortable with Dr. Smith, plus my first meeting with Dr. Smith. And like I said, his honesty in the whole process has been, you know, for me, comfortable. So yeah, I have confidence in his skills to do this right.
After talking with Dr. Smith showing what on the MRIs, where the problem is, and what needs to be done, and the candor that he did display with my husband, and saying that he had worked with other police officers before, right there the ice broke, and it was like they'd known each other for more than those minutes in. We did take our films back because I have had back surgery, and we were going to seek a second opinion. And as we were walking out and discussing the second opinion, within the next day I canceled it, and we continued with Dr. Smith. It's kind of ironic because his birthday is the 12th of this month, and as his present, I got him his cross and his St. Michael's because he's a police officer, and I love him with all my life. He's never had any injuries at all, and I want him back. The way Dr. Smith is like a library book. I want him checked back in even better than I'm checking him out. I love him with all my heart. He knows that. And I know he's going to be fine, and it's going to be the Poynton Hospital, and I'm going to have fun taking care of him. But I'll just be glad when it's on the other end, because I am worried.
My first fear when I heard cervical surgery was that I was going to be in like a halo or a, you know, a traction bed for any length of time. When Dr. Smith said it's outpatient surgery, I was like, really? Are you sure? I mean, you know, and to me it's just amazing that it can be done in one day, and I could be at home tonight watching TV with my wife. So it's outstanding. Thank you, a huge thank you. If this does what it's projected to do, I'm ecstatic. I couldn't give him enough thank yous. I am completely amazed that it could be done, like you said, 26 minutes, and I'm walking out of here, and hopefully, you know, fingers crossed, everything in 2 weeks will be perfect. So I'm happy.
I am so happy. I am so relieved. This is a new start for us. Before we met Dr. Smith, my husband was saying we're middle-aged, we're towards the end, and it's like, no, we're not. We're not towards the end. And he was giving up hope, and today it's a new day. As I've said before, we've been together 26 years, and this is going to be our starting of our new first of the next 26 years. You're going to see me as your next patient. I will definitely refer him to anyone because I can see, for one, the change in my husband's outlook right now. Secondly, what we're going to see in the progressive future. And thirdly, is how it is going to change our life, and it will change others.